Good afternoon, everybody, and welcome to our Nottingham City Integrated Care Partnership Share and Learn. It's great to be here today and to launch our second series of Share and Learn. I'm Tracy Tyrrell. I'm one of the Deputy Clinical Leads for the ICP. We're going to follow a usual format that we used last time. So we've got Dr. Hugh Porter presenting today, and then he'll present for 20 minutes and then we'll have 10 minutes for questions and answers. And what we'll be encouraging you to do is to pose your questions in the chat box. So warm welcome to Dr. Hugh Porter, and I'm going to hand over now to him.
Afternoon, everybody, and thank you very much for those kind words, Tracy. Delighted to be here this afternoon. And as Tracy said, I'm going to rattle through some slides. Hopefully keep to 20 minutes. I'm sure Tracy will keep me on track, and then I'm absolutely delighted to take some questions. As ever with these meetings, if you have sort of stuff afterwards you want to discuss further, please do get in touch, because we're happy to have an ongoing conversation. So I'm going to sort of break down this sort of little talk into three bits. I was asked to talk about an update on the ICP or Integrated Care Partnership, but I thought I should spend a few minutes just taking us back through a bit of history of how we've come about, and then a little bit about the current programs and what they've been doing over the last 12 months, some of the achievements, because I think it's really important, given everybody's been working so hard, to sort of celebrate some of the good stuff that's going on, and then going to sort of look forward over the next 6 to 12 months as to what's happening in the system and a little bit about where the ICP is going. And as you can see here, ICPs are increasingly being called place-based partnerships. So flick through the next slide, Daniel, for me. And then the next one again. So as many of you will know, and apologies if many of you know this, but I thought it's important. Obviously, Nottingham City Integrated Care Partnership is part of the Nottingham and Nottingham Integrated Care System. This map's a little bit out of date because, as many of you may be aware, Bassett Law have actually recently joined our ICS, so we're about 1.2 million people now. And next slide. And there are 4 place-based partnerships within our ICS: Bassett Law, Mid Nottingham, South Nottingham, the City. As you'll know, the City covers a population of about 330,000, but the GP registered list for the City is about 390,000. High levels of deprivation, and it's important to say that the partnership is more than just a health partnership. So next slide, please, Daniel, if you can. Many of you will be more than aware of the challenges we face in the city, and just a couple of very quick slides. So we're a young city, we're a very diverse city, but we have a lot of challenges around ill health, a lot of deprivation. Next slide, Daniel. And I wouldn't want to sort of go through this in detail, but I think just to sort of highlight the sort of degree of red and amber for the sort of city around life expectancy, healthy life expectancy, years and poor health. And as you can see, a substantial block of red and amber that covers the, sort of the city area. And that's one of the things, of course, that many of us will be working at throughout our sort of careers and trying to address. And next slide, please, Daniel. And there's been all sorts of attempts to start to make inroads to some of these challenges, and the Integrated Care Partnership is a sort of new, broader, slightly different approach to saying how can we try and get into addressing some of those really stubborn challenges that we all see in our day-to-day lives. And we're a broad partnership, as you can see here, so many health partners, but also critical partners include people like the local authority, Nottingham City Homes, so really giving us some reach into those wider determinants as well as the community and voluntary sector. Next slide, please, Daniel. The ICP itself is relatively small, so I think it's important to just remind you we're not trying to create a great big new central body. That is not the function of the ICP. It's a relatively small team. What we're trying to, next slide please, Daniel, is actually help the system work better together to unblock areas, get us to have different conversations, and start sort of thinking and working in different ways. And if there are blocks that come up, working together, say, how do we actually unblock some of these things that have stopped us moving forward? Next slide, please, Daniel. Important, many of you will be aware of these things called primary care networks. These were mandated in the GP contract in 2019, and these are fundamental building blocks of Nottingham City ICP. There's 8 in the city. You all cover populations between about 30 and 65,000. They started as groups of general practices collaborating together. That was part of the GP contract, but increasingly they will move to sort of providers across those neighbourhoods, and we tend to call these areas neighbourhoods, working together. Next slide, please, Daniel. So, what have we been doing over the last 12 months? Well, quite a lot, really. And as you can see here, we have 5 core priorities that are around our citizens, and I'll go through those in a little bit more detail. And then we have 2 other priorities. One is about developing the ICP and its PCNs itself, because we're a new thing. And the 7th one is about supporting the wider system. The neighbourhoods are part of the place is part of the system. And it's important that we are cognizant and aware that we are part of that system, and we need to work in that ICS space. Next slide, please, for Daniel. I talked about those 5 citizen areas we sort of started to talk about, and we chose those very specifically, really. So we didn't want to boil the ocean by trying to do everything, and we really wanted to learn by doing. All the experience says if you really want to sort of start working in different ways, you can spend years planning and doing very fancy structures, and that is important, but actually just getting on and doing some is really, really important. And slightly differently, what we did, rather than perhaps take a sort of purely health focus, so that might be disease specific areas, chronic respiratory disease, heart disease, diabetes. As you can see, we actually went for defined cohorts of our population. So that was people with severe multiple disadvantage, care leavers, and that creates a different slant and allows us to think wider than just that health focus. Next slide, please, Daniel. I'm going to very quickly whip through these. And obviously part of what we're trying to achieve is moving from what actually many of our citizens currently experience, which is care that really isn't as joined up or as slick as it should be. And despite all our efforts so far, that's something we persistently hear when we speak to our citizens. Next slide, please, Daniel. To that, okay, very, very simple, a diagram, really quite hard to achieve, but we've been working really hard over the last sort of 12 months on these cohorts, and actually I think some really interesting stuff. Next slide, please, Daniel. So I'm just going to sort of give a couple of headlines, and the other thing to say is we'll happily share these slides if people want to sort of see them. So the severe multiple disadvantage, we've actually done a lot of work. So this was sort of partly spurred on by the Everybody In campaign and the which was a national campaign by government for the homeless people during COVID, and we successfully have a sort of an MDT, single point of contact, really trying to wrap around some of our most vulnerable citizens and our homeless cohorts, and actually we've housed over 100 people in stable long-term accommodation, which actually is a real move forward for some of these people who have been rough sleepers for a very long time. But equally critically is it's not just getting them into accommodation, it's wrapping around them and supporting them to help them move forward. And that's been a huge springboard for a bid for something called the Changes Future programme. This is the Ministry of Housing and Local Government, and the ICP has been awarded £3.9 million over 3 years to really look at how we support people with severe multiple disadvantage. You probably need to flick down because there's some other bits to come up as well on this one. done a huge amount of work around the flu program both last year and actually obviously just on round 2. Worked very hard at some specific cohorts, for instance pregnant women, and actually we were one of the few core cities to actually increase flu uptake in pregnant women last year. Most areas saw flu vaccination rates fall in these cohorts, but actually through the partnership we managed to increase some of these uptake rates. And we've been doing a lot of work with smoking, looking at how our services are delivered. They could argue they were quite disjointed, and actually we spend a lot of work with partners saying, actually, how do we make our smoking cessation services more consistent, more accessible, and we're just about to do a load of work with Stocktober. Interestingly, if you look at the stats for the city, over 20% of the city smoke. That's about 50,000 people, so it's a lot of smokers, huge health burden, real opportunity for us. Next slide, please, Daniel. And if you flick this through, care leavers. So a relatively small cohort of our citizens, but actually we know from feedback, we know from looking at this group that they really sort of struggle as they move into adulthood. And we've worked across the partnership, but also with Barnardo's, and that's one of the beauties of something like the ICP. We can actually reach out to different partners, so we worked with Barnardo's, and we have 10 new supported ongoing placements for care leavers. Again, a bit like that SMD model, looks at that wraparound. So there's a statutory duty to provide accommodation for these young adults as they move into the adult world, but actually that's just a part of the sort of conversation. They need a lot of support through their early adulthood, and that's one of the things we really started to look at, how we best provide that over actually potentially several years. Because I don't know about yourself, but when I was 18, I would have struggled to really sort of look after myself and actually move completely independently through the world. One of the things they consistently tell us is a major issue with transition of mental health services from childhood to adulthood. So we'll be doing a lot of work on that. And equally around aspiration, we've worked with a mentorship scheme for these young adults. So actually they can be mentored and actually can look at how we drive aspiration in these young people, because that's a really important wider thing to think about. And then we've been doing a lot of work around obeying health inequalities. Obviously hugely diverse, vibrant city, really important. I think many of us have felt the significance of the Black Lives Matter campaign and the issues that's highlighting, and undoubtedly there are issues in the city, and that's one of the things that actually our citizens said they really wanted us to think about. We're doing a lot of work working with commissioners about how we commission, but also obviously COVID put a different spectrum on that, and we'll be doing a huge amount of work with our communities, both in places like mosques, with the bus, looking at how do we reach out to these communities, improve some of their vaccine uptakes, work with them around their vaccine hesitancy concerns. Next slide, please, Daniel. And the final bit on the outcomes, I talked about 6 and 7, so we've also been developing the ICP, and some really good stuff going on here actually. So many of you might have heard about green social prescribing. We were awarded some money to look at how we increase use of green space. That's green social prescribing. So through our PCNs, we have social prescribing link workers as part of the national contract. But this is in addition to that, and real opportunity to actually say, how do we get our citizens engaged in that green space, using that green space? Huge benefits for mental health, which is really important, particularly given lockdown and COVID. Huge benefits around obesity and inactivity, which is a major issue for us. This is part of developing the ICP, so thank you for joining us. Small part, but really important part, learning about each other. We have a co-mentoring scheme, so lots of stuff going on across the ICP and the PCNs itself. We've got a couple of PCNs where we're really trying to accelerate their development, doing population health management pieces at work, and even working with people like Trent's Bridge Community Trust and working with our PCNs around men's mental health. So a huge opportunity to learn by doing and thinking about that wider determinant conversation, but also using different partners to reach into different bits of our community. And next slide, please, Daniel. So looking ahead, next slide. So most of you will be aware there's a lovely NHS reorganisation going on. Many of us will have lived through many of these reorganisations, but this one is working its way through Parliament. Next slide, please, Daniel. Here we go. And so CCGs are finishing their lives in April 2022, and ICSs will become what are called sort of statutory bodies. Importantly, places like Nottingham City recognises sort of really key to the success of the future, which is a really positive thing for us. So that means we're ahead of the curve, and they're going to be one of the cornerstones of this NHS reorganisation. The other sort of cornerstone is going to be something called provider collaboratives, and that's perhaps going to be particularly focused on some of that clinical service improvement, particularly around the acute hospital side of things. Next slide, please, Daniel. So various documents have been published on this, and people are welcome to sort of search the internet and have a little look at them. I think dry for most people, but important sometimes to read. And there has been documentation about the development of places. It's called Thriving Places, and there's some guidance for us to look at, and we're busy working through that with our other ICPs and with the ICS and the CCG to make sure we have a safe landing by April 2022. Next slide, please. But that's all pretty technical stuff. Important, it's got to happen. We've got to give it some time, got to give it some space. But actually, most of us don't come to work for what we're going to be doing in terms of governance or meetings and stuff like that. We're coming to work for our citizens, and certainly we're still passionate as the ICP to keep going forward and doing stuff, learning by doing stuff. Next slide, please, Daniel. So we had our priorities that I talked about a couple of minutes ago. And so those are still staying. We're not getting rid of those, but actually we're going to try and build on some of the stuff we've done, trying to accelerate some of the stuff we've done, trying to broaden some of the stuff we've done. So I talked about the changing bid. That's going to be a huge turbocharge for our citizens with severe multiple disadvantage. That 3.9 million over 3 years gives us a huge opportunity to start to think of how we can do things differently. Importantly on that, we have in Nottingham had something called Opportunity Nottingham. Many of you will be aware of this. This was an organisation that's done a huge amount of groundwork on this sort of cohort. Their money runs out in June 2022. So actually is a real springboard to take this forward, and particularly how we embed dealing with these often very challenging citizens throughout our organisations. We're going to continue working with the care levers, quite a lot of work to do that. Some of that stuff I talked about earlier is in early phases, particularly that CAMS to adult mental health transition piece of work. Actually, we need to finish that off. We need to land that right. Lots of work going around the smoking. I mentioned stopped 50,000 in the city. Stoptober's come in, so please in your organisations push your organisations to get on board with that. A huge opportunity. And we're also looking and working with the ICS and the City Council around the tobacco control strategy. What can we do to try and really make further inroads into those persistently high smoking rates we have in this city? Working really hard on the flu vaccination programme, and of course continuing to work on that health inequalities agenda, particularly for our BAME citizens, particularly around the vaccinations, but not just that, and working on that wider health inequalities as well. Earlier this year, we went out to our citizens and our partners and said, we've been going for about a year. These were our original sort of programmes of work. did they feel right? Did they have any comments? What were their sort of current concerns? And actually, really important thing to say that one of the things we're committed to do is consistently listen and co-produce with our citizens. And the thing that came back, I guess most of us will have seen it in our day-to-day work, is actually we need to also pick up something around mental health and well-being. Lots going on here already, but there's some real opportunities for us to think about how we do that in a different way. So we're just starting to sort of scope that programme and look at it. And next slide, please, Daniel, and we're nearly finished, and I'll take questions in a minute. And just to let Tracy know, so I'm watching my clock. Talked about the PCNs, core bits of foundation for the place, and we really want to support their development, accelerate those through, and we're working with our PCN in Bulwell and Top Valley and our PCN City East, which is sort of St Anne's, Sneinton and Bakersfield, to say actually how can we support them to really accelerate moving from groups of practices towards actually wider providers wrapped around the neighbourhoods and really understand the neighbourhoods, and actually perhaps thinking about a neighbourhood leadership team, integrated local teams at that point of view. So really working with that. We're working with the ICS to say, okay, we're taking on some responsibility for some of these sort of cohorts, but actually should we start to look at taking some slightly bigger steps? They said we're doing sort of not boiling the ocean initially, but starting small. So we're having conversations with the ICS about actually should we start to take some responsibility for something a bit bigger, maybe something like diabetes. Just floating it, that's got to be worked through. And of course, we're going to continue working with the ICS, both around the COVID vaccination programme, but also the other challenges we face. And importantly, sometimes you might see in the press, the ICS says it has 3 signature projects: community transformation, children and young people, and personalisation. Really big schemes across the system, but we want to be deeply integral to those, really help support those, because they're really things that we are passionate about. So next slide, please. So I'll leave it there. Apologies for quite a rattle through, but I hope that's been helpful, and happy to take any questions.
Thank you, Hugh. That's been great. So some positive comments coming in. So obviously really great to see the progress and also to hear it from you this afternoon. So one of the first questions is around co-production. So
Yeah.
just keen to hear your views about how we can take co-production forward for our citizens across the city.
Thanks, Tracy. And it's sort of something obviously I mentioned in there. Co-production isn't new. It'd be foolish to say it's not something people have talked about and tried to do before. So, but as we'll have noticed, it can be quite difficult. Right? It's easy to say, it's sometimes quite hard to do, right? And to do it properly at depth. But actually, it's something that we're sort of trying to build into the DNA of what we're doing. I think that's important. So having it sort of integral throughout what we do whenever we're doing something, rather than thinking let's get on and do this, oh we better do a bit of citizen engagement or something, if you see what I mean. So not having a sort of a back end, but saying having it right integral woven through us. So that's co-production at different levels of the system. Okay. So a specific service, we're looking at that. Obviously we want to get citizens involved, and for instance in the SMD we've had people with lived experience right at the front end, right at the heart of that. Hugely powerful for us. Okay, so we want that co-projection to happen at that level, but also when we're thinking of these broader sort of themes or broader strategic stuff, actually we're trying to say actually what does strategic co-production look like? How do we have these bigger conversations? I mentioned at the beginning of the year we went around and started conversations with our citizens, and we're doing a lot of work with that. How do we have conversations both as an ICP but also tap into our individual organisations who have the resources and the skills to say how do we pull that together into a cohesive whole. We're very lucky, probably she might be on call, we've got Ali Roberts who's just joined the ICP, that very sort of core central ICP time as a comms and marketing sort of manager, and I think Ali's going to be really helpful for us in actually accelerating and maturing that a little bit.
That's lovely. Thanks, Hugh. That's great to hear. Another question then is, as we're thinking around, you talked about some of the reorganisation, so CCG's obviously going, the ICB, the ICS. So just really a question around, where do you see place-based partnerships future? And do you see them as an employer, or do you see it as a non-formal group? And how do we see that collaborative working for the future?
It's acronym city, isn't it, going on?
I
here?
know.
The system loves an acronym. I think we're on a couple of things to say on that one, really. I think we're on a journey. So by April 2022, we're just going to be part way down the journey. That's the first thing to say. Do I think the place-based partnership will be a statutory entity at that stage? Certainly not. And actually, if you look at all the legal stuff going through Parliament, they're not envisaging places at this stage to be statutory bodies. The ICB, that thing, that is a statutory legal thing. Okay, local authorities and health wellbeing, they're still staying, but they're not envisaging places to be statutory employing bodies in that sort of short term. Who knows where it may go, but not just yet. What they are saying, and they're envisaging, and we're part of the journey, that as we mature, they will expect the place partnership to start taking more responsibility, more accountability, and more budget. It comes with that, because I mentioned that a little bit. Obviously, we're doing a lot of important work, actually really some interesting stuff, but actually we're not formally accountable for huge wads of spend, either NHS money or local authority money. At some point that's probably going to increase. I mentioned to say we're possibly taking some bigger steps, and that's when we start to have a think about the accountability structure. We'll work on that. So I don't think we should get bogged down on that. There's ways through that, and we're having conversations across the country from that point of view. So eventually places will become more, place partnerships I think will become more solid, but it's not in the short term just yet, Tracy.
That's lovely. Thank you, Hugh. So I think that's our questions. So thank you everybody for joining this afternoon. Just to share that our next session will be on the 26th of October. We're delighted that Dr. Margaret Abbott is going to be talking to us. Margaret is our Health Inequality Lead for the ICP, and is going to be talking about population health management. So do join us for that. Also, the slide deck will be on our Twitter feed, and we will also share that out widely. But huge thanks for this afternoon, and have a good afternoon. Thank you. Bye-bye, everybody.
Thanks, Tracy. Been a pleasure.
Thanks, Hugh.